The patient should be placed on the surgical table with buttocks even with the table break of the lower section. Be sure that the sacrum is supported by the table. Ensure the clamp and proximal locking joint are in line to the approximate location of the patient's greater trochanter. When the stirrups are in place, tighten the clamp knobs. The top flap can be moved out of the way and secured to the boot by wrapping the straps around the bottom of the boot. The left and right boots should be placed at the same location on the rods by using the rod placement indicators. Place support rods and stirrup boots as close to the table as possible. Loosen boot locking handle and aim the boot at the patient's opposite shoulder. Slide the boot so that the back of the medial boot fin is aligned to the back of the knee. Open top flaps and slide between rod and table. Place both legs in stirrups simultaneously. Put one hand under the patient's knee while the other hand holds the patient's lower leg above the ankle. Push the patient's heel gently into the heel cup and confirm it is completely seated. Ensure that the patient's tibia is safely seated within the boot. Pull the padded top flap over top of open boot and patient's leg. The padded top helps protect the patient's leg. When the secure lock straps are closed, they will make an audible click. The amount of flexion in the knee should be determined by the surgical procedure, patient anatomy, and the patient's tolerance for movement. High lithotomy position would have slight flexion, while medium to low lithotomy would have more flexion in the knee. Care must be exercised not to hyperflex the patient's knee. Ensure that the patient's toe and knee are lined up with the opposing shoulder to ensure good alignment. Twisting the ergonomic actuation handles allows simultaneous abduction, adduction, and lithotomy positioning of the patient's legs. When the patient's legs are in the desired position, release the handle, locking the stirrups into place. The patent-pending KYRA single stirrup boot cover helps protect surgical patients, equipment and staff from cross-contamination and saves room turnover time. KYRA single covers eliminate the ick factor of placing multiple patients' exposed feet directly onto the stirrup pad surface all day. The KYRA stirrup cart is a safe and convenient way to protect your stirrups. The ergonomic round cart handles make transport easier. The handle secure feature keeps stirrups from falling out of the cart, while the holding scoops in the cart base keep the stirrups from colliding into each other. The convenient storage area can hold clamps or other accessories. The high-quality casters keep the cart tracking and come equipped with locking brakes to keep the cart from moving inadvertently.